Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue therapy part 23, Kalium 3. Kalium for urinary symptoms. Kalium is indicated for second stage of inflammation of urinary bladder when there is swelling and secretion of thick viscid white mucus, chronic cystitis, urine of high color with sedimentation of uric acid along with sluggish liver. Nectum salve is also recorded here. Second stage of nephritis when urine contains albumin. Kalium for male genital symptoms. The chief remedy for gonorrhea. One may call it almost specific. Suppressed gonorrhea causes inflammation and swelling of testis, orchitis. Now see the images here. This is cystitis. This is cystitis. This is gonorrhea and this is orchitis. Bubo with soft chancre, that is syphilis. This particular medicine covers both the chief diseases in the genital systems, gonorrhea as well as syphilis, when there is characteristic white discharge from this chancre. In chronic syphilis, tongue grey, soft chancre in cheek. Also use 3x externally and internally. You can use externally and internally the medicine. In external, you just give dust of the things over the ulcers, or you can make a ointment with olive oil or glycerin like thing or vaseline like thing. You can use it, or you can directly use dry powder over the ulcers. Kalium for female genital symptoms: painless, milky white, bland discharge. Bland discharge, mind it, bland discharge. Belated or early menses, profuse blackish coagulated blood like tar. Malodorous flow runs from many days, that is menstruation. Along with Kepi is also there, that is Kalium phosphoricum is also used in this case. Along with characteristic tongue of Kalium. Mind this, characteristic tongue is Kalium this term will be coming very often. This is characteristic tongue, white covered. Sometimes there is a central fur, this vertical fur is there also. Amenorrhea, menses suppressed, ulcer of the os means of cervix or cervix uteri, with white discharge, hypertrophy or congestion of the uterus. In this case, calcarea fluid is also required. Kalium for problems in pregnancy, morning sickness. This is morning sickness. And this is uterine hypertrophy. Hypertrophy means within uterus body there are fibroids. This fibroid will cause the hypertrophy of the uterus. So morning sickness, mastitis of second stage. This is mastitis. Mastitis of second stage, that is just swelling and fluid just starting accumulation, but there is no much fluid or no pus is there. Second stage of inflammation before pus formation. Puerperal and milk fever. These two fevers are covered by paraphos and Kalium. Mania, hysteria, perverted mental state due to toxin of puerperal fever. Puerperal fever actually some bacterial infection occurs after delivery of child in mothers. That infection may cause this milk fever, puerperal fever, mania, hysteria, perverted mental state, many things. But Kalium is a good friend of ladies in this situation. Kalium for respiratory symptoms, second stage of inflammation of any part of windpipe. Any part of windpipe, mind this, any part. Thick, viscid, white mucus with whitish tongue. That tongue is characteristic tongue of whooping cough, croup, bronchitis, pneumonia, tracheitis, laryngitis, asthma, bronchiectasis, chronic obstructive pulmonary disease, tuberculosis, etc. Second stage of inflammation of all these. You can name any inflammation relating to respiratory organs, and if it is within the second stage, then Kalium
and ferrum phos will take over. Total case will be taken over by them. Hoarseness of throat and loss of voice also is there. Now this picture is a croup. Croup actually the cough is due to congestion in the windpipe. This is windpipe. This is windpipe, trachea. When there is congestion in the windpipe, the cough is a particular type that is called croup cough. Asthma. Asthma, you know, asthma is there is shortness of breathing. The patient becomes very weak. Sometimes it sweats all over his face. But in asthma, there is always something allergic infection, not ordinary infection. Some allergy is the particular person has got some allergy to particular allergens, and from that case, when this type of difficulty in breathing occurs, this difficulty in breathing you can see in many diseases also. Let's say bronchitis also, bronchiectasis also, pneumonia also, but the reasons is different. Here, the main reason is allergens. Now, bronchiectasis. Bronchiectasis is, this is the bronchus. This is also bronchus. This is healthy bronchus, and this is inflamed bronchus. When bronchus is inflamed, you see this particular the lumen has been blocked by thick secretions. This causes less air inside the lung, and the patient suffering from breathing trouble. This is bronchiectasis. COPD is also one part of bronchiectasis and chronic bronchitis. Both the things jointly called COPD. Chronic obstructive pulmonary disease is a very common disease of old age. Very common disease. You can see it in lakhs or rather millions in our country. COPD. These are big, very huge name diseases, but medicine is simple one, Kalium. Start with low potency from 3x, 6x, 12x, gradually go upwards. Maybe that you may cure a particular case. You may cure a particular case, and the diseases are so many diseases it is. Bronchitis, inflammation of bronchus, pneumonia, that is inflammation of the alveoli, tracheitis, trachea, this is trachea. Laryngitis, larynx, voice box, asthma, I have already told, bronchitis is already told, chronic obstructive pulmonary disease, the group of 2 diseases, even tuberculosis. In all this case, if it is in the second stage, then Kalium is the medicine. Mind it, Kalium is the medicine in the second stage when there is not too much pus secretion or there is not too much secretion of viscid fluids. Not too much, but just started in the starting phase. Second stage means starting phase of inflammation. When this stage is advanced, then it will not be do good. Then you have to go up to either Kalium sulf or calcarea sulf. That we will be discussing later on. Kalium for symptoms of circulatory systems. Second stage of inflammation of pericardium. Same thing, second stage inflammation. Pericardium is covering of the heart. Covering of the heart. A double layer covering covers the heart. It's called pericardium, and inflammation of the pericardium is called pericarditis. You have to use this along with ferrum phos. Palpitation of the heart and embolism of heart. Palpitation, you know, when the heart throbs is audible visibly. I mean, you can see it. Their heart is palpitating, and the patient will report, yes, he is feeling much throbbing in the heart. That is palpitation of heart. Some sort of trouble in the heart functioning. Embolism of heart. In the heart muscles, there are so many arteries. If the artery is blocked with some embolus or clot of blood, it is called embolism. In advanced case, this can cause heart attack even. Kalium for symptoms of back and extremities. Rheumatism of any part, the parts become swollen, sore with accumulation of inflammatory fluid. Just starting phase, pain worse at night from movement, from heat of bed. Hands and feet become stiff. Use ferrum phos and Kalium in acute stage for this trouble. Hands and feet will become stiff. That is some sort of rheumatism actually, acute rheumatism it is. If part becomes hard and swollen, use Kalium and Cerampos alternately. Calamure control any type of swelling with Cerampos and CF. The two different stages have been described here. Please note this carefully. And these are the images: rheumatism of shoulder, rheumatism of the hand, rheumatism of the feet. That have been described here. Calamure for symptoms of back and extremities continuing. Rheumatic fever with exudation and swelling of joints. This is advanced stage. Rheumatic fever is very serious thing. Even rheumatic fever may attack your heart even, and the heart in the chambers. In between the chambers there are we call it valves. The valves are affected in rheumatic fever. That is a very serious disease. So that rheumatic fever also is covered by Calamure. Swelling of joints, acute articular rheumatism. Articular rheumatism, that is joints. Various joints are affected. Note this. Various joints are affected. It is called articular rheumatism. Chronic swelling of legs and feet. 2. This is feet. This is swelling of feet. This is a pitting of the edema. That is edema in swelling of tissue space. Fluid accumulates in this tissue space. It is called edema. If you press with a finger, there will be pit. That is called pitting edema. Actually, there are so many causes for this thing. Main cause is liver cause, or lung cause, or kidney cause. Thereafter, many causes extra. Maybe there are some infection also be there. But these are the most 3 important causes I have described. In all the cases, Calamure can taken up because Calamure looks after liver, Calamure looks after heart, Calamure looks after kidney also. This swelling becomes also painless and itching violently. Second stage of hip joint disease. That is a very serious disease. I have not given many pictures here. Hip joint disease have been described many times in many places. Certainly, if you go through my videos, you can face this. Hip joint disease means the joint with the femur bone and hip. That is a very serious joint. Generally, old age people are affected with it, and it's a very, very painful, serious disease. If you treat it in the starting, then the problem will be over. Otherwise, there may be serious problem of the patient. Serious problem. Tenalgia crepitans. Actually, this is nothing. The name is something peculiar, but it is inflammation of the tendons. I mean the covering of the tendons. Inflammation of some covering of the tendons, which give rise to crackling sound. Sometimes we get this when we just move our fingers, joints, etc. That is called telangia crepitans. You ulcer on extremities with fibrinous discharge. Picture 3. These white secretions are called fibrinous discharges. Bunions actually not given here. Picture is not given here. Bunions means some type of corns. Chilblains of hands, feet. This is chilblains of feet. Chilblain means disturbance in the blood circulation owing to low temperature. This is called chilblain. There is some sort of this attack of cold on some extremities, hand, feet. Generally, it is seen in very cold area or when person goes to some hilly area, very of high altitude. Then chilblains suddenly attack them. Feet or anywhere in the chilblain, Calamure is a good medicine.
Life case: 10 years old Jhorna with boy cut hair had come to my chamber with his father. She used to suffer from fever very often. Temperature rose 3 to 4 degrees Fahrenheit above normal and continued without respite for about 2 weeks. Generally, she used to take remedies of modern medicine. She maintained a good health. Problem was with the temperature only. During fever, she lay down on bed all along quietly. I noted her face was pale, had a little anemia, but her body temperature was normal. I asked Jhorna's father to call in me during next attack of fever, because when she had come to me, she was quite normal. There is no temperature, nothing else. About 10 days after, I got a call. On examination, I noted temperature 101 degree Fahrenheit, pulse 105, respiration 22 per minute. Tongue was whitish coating with central fur, abdomen no bloating, no tenderness, eyes and nails no jaundice. Kalium 6x to gain dose 4 times a day was prescribed for 1 week. Advised to give her plenty of liquid diet with glucose. In the morning on 7th day, it was reported that for last 2 days there was no fever. Day before yesterday, she passed semi-solid stool but now feeling very weak. She was slowly walking in the room, taking normal diet. On my request, her face was WhatsApped, and I noted that there was no toxicity on her face. That is, he is in the convalescent stage, I think. He is going to be cured. Prescribed to report the remedy, to repeat the remedy for another week. On 12th day, it was reported that she was fully cured. Started doing study, playing game courtyard with her peers. I instructed to complete the course of the medicine and as usual and contact me in the case of emergency. With this, the video ends. Thanks for listening and viewing.